So it's now recording. So again, good afternoon, guys. This is our long overdue discussion of perioperative nursing. So again, if you have any questions, so just type it in the chat box. Okay, even those who are in Gmeet, so just kindly type it on the chat box. Okay. Pasensya na, medyo maingay lang. So mamaya mawawala rin sila mamaya. Can you please go? Bilisan mo na. Okay? So again, perioperative nursing. Do you know what? In the previous curriculum, OR nursing is actually a separate component of medical surgical nursing. So that's why all of these are discussed. Kaya lang sa inyo, we only integrate operative nursing, okay, perioperative nursing during your NCMB 312 RLE. So kaya very short lang yung discussion. So there are some concepts by which we will discuss na pwedeng na-discuss nyo na before, and there might be some concepts that are new to you. Okay, so kaya I encourage everyone to ask questions if you have any. So again, we will have maximum of 300 participants on Zoom, maximum of 100 participants on Gmeet. So I hope everyone is here. We'll take the photo later after the discussion. So let's also hope that we would be able to finish the discussion by 6 or 7 p.m. No, dire-diretso na yung discussion natin. So again, what is perioperative nursing? Ayan. So, tahimik na yung buhay ko, lumabas na yung mga bata. Okay? So, what is perioperative nursing? So, alam natin when we talk of perioperative nursing, we are pertaining to the management or the nursing procedures, okay, by which we do, okay, during the course of a surgery or inside the operating room. Now, first, what is surgery? Okay, when we say surgery, this is a medical specialty, okay, by which, ayan, nursing care in the total surgical experience of the patient. Totoo yun, no? Tama naman yan. Now, we know that surgery in its proper context, no, it is a field of medicine that applies manual and instrumental techniques, okay, for us to investigate, to treat, okay, or to totally eradicate a certain pathological condition. It could be diseases, injury, or pwedeng corrective surgical management, di ba? Kung merong mga malformities or merong mga tawag dito, may mga damages na nangyari because of mechanical injuries or pwedeng self-accident or even congenital problems. Now, the main goal of surgery, di ba? Why do we have to do it? Kasi remember, surgery is always invasive. Surgery is always invasive. May mga sasabing non-invasive surgery, medyo technically hindi siya correct. Okay? Kasi talagang when you say surgery, we are dealing with cutting out, slicing in, di ba? Opening, certain okay? So yan. Pero the main goal is of course to improve body function. For some, it's to improve appearance, di ba? Kahit wala namang problem, they will undergo surgery just because they want to look good. Okay? So we know that's basically for aesthetics. And there are other purposes of surgery. Okay? So first, surgery, sabi nga natin, it can be used to correct deformities of certain congenital defects. Okay, example, yung corrective surgery para sa mga clients with cleft palate and cleft lip, di ba? So, it's an example of a surgery. Now, surgery can also repair injury. Okay, let's say you have injured your ligament. You have injured let's say you have bone fracture. So surgery can also be used to repair those types of injuries. Now, it can also be used to alter form and structure. Diba? There are some aesthetic surgery that aims to, diba, just make it look beautiful. Okay? Medyo flat ng konti, pa-opera mo, so you will alter the form of your nose, your cheek, diba? Name it, kaya ng surgery yun. Of course, surgery can also be used as a diagnostic tool in cases of cancer. Diba? It will help us get tissue sample from visceral organs, ibig sabihin yung mga organs na sa loob ng katawan, for us to diagnose what is the problem, okay? Based on the tawag dito, histological data, 'di ba? Based dun sa tissue na makukuha natin. Then it will also help cure the disease process. You can remove tumors. So, ayan, it's very self-explanatory. Now, surgery can also relieve suffering, 'di ba? If the mass is too big, it's very uncomfortable, then we can excise the mass. Okay, if it's too painful or if it causes further infection, then you certainly remove certain, let's say, limbs. So, relieve suffering. And lastly, we perform surgery to prolong life. That's why the decision of having the patient go under the knife, okay, rely on how urgent and emergent the condition is. If the patient, if the surgeon knows that the patient can't make it despite having the surgery, or the surgery itself could be, well, putting the patient at risk, okay, of death, then we may opt not to perform surgery. Okay, kaya may mga ganon, di ba? Ma'am, bakit hindi na lang siya operahan? Well, the main reason could be because pwedeng yung surgery, instead na makatulong, lalo pang makakasama for the client. So, these are the purposes of surgery. Next, of course, what can be treated by surgery? So first, it can treat obstructions. Let's say, for example, a mass obstruct the colon. Okay, so you can remove the tumor, you can remove the mass so that the flow of GI contents will not be impeded. Or in cases of mga thrombus or mga atherosclerotic veins, 'di ba? Arteries rather. So, we can remove kung ano man yung obstruction to promote the flow naman of blood. It can also be used for perforations. Example, ruptured appendix. Okay, so we know that it will be harmful for the client, so we may be removing appendix na in that case. Or if the ruptured organ is necessary, let's say, for example, there is bladder rupture. So the urinary bladder is ruptured. It is perforated. So we can perform surgery to repair the perforated urinary bladder. We can also do this for those who experience erosions, 'di ba? Yung mga meron na tayong mga grafting. Ayan, so wearing of. Next time kamo, kapag pupunta sila ng GMeet, make sure to use Fatima email, ha? Okay? So when we say erosions again, it can correct, let's say, clients who experience the burns, 'di ba? They can undergo skin grafting. So, yon, pag sinabing erosion, wearing off surface or membrane. Tumors, of course, ayan, tumors can cause obstruction, tumors can cause deformities, tumors can cause discomfort, tumors can cause metastasis. Okay, so if the tumor can be removed as early as possible, then it can be removed by means of surgery. Yan, okay? So, may mga nakikita akong comments sa chat box. I appreciate your comments. Kapag hindi ko na binanggit, ibig sabihin, yung comments ng kaklase ninyo is tama naman. And it's like having interaction lang, no? I really appreciate that. So, keep those coming. Thank you. Next, ayan. So, let's talk about the classifications of surgical procedure. Na-discuss ba to sa inyo dati? Kasi kung na-discuss, pasadahan ko lang. Pero kung hindi na-discuss, we will discuss it detailed. Naisama ba to sa RLE ninyo? Okay, very good. Very good. So mabilisan lang. So surgical procedures can be classified according to purpose. Okay? So what do we mean according to purpose? Okay? So there are surgeries that are done again for certain purposes. So sabi nga natin, surgery could be diagnostic in nature if we do that to establish a presence of disease or condition. Let's say, for example, dilatation and curettage or fractional curettage. Ayan. So when we say fractional curettage, may tatanggalin, may i-scrape sa part ng cervix, may scrape sa part ng vaginal wall for us to help diagnose the presence of cervical abnormalities or vaginal abnormalities. Now, it could also be exploratory. So if we want to confirm a certain diagnosis, you would want to see, or the surgeon would want to see for themselves how the organ really looks like, and compare it to how it looks like sa imaging tests, so we can perform exploratory procedures, 'di ba? Isa sa mga best example dyan would be exploratory laparotomy. Okay, so we open the abdomen and see what's inside, 'di ba? See for themselves how the colon looks like, how the small intestine looks like, for us to determine, hey, okay, it's really is this condition. So, again, exploratory. Now, it could also be curative or therapeutic if we want to treat a previously diagnosed condition. 'Di ba? So, again, you can perform mastectomy. Okay, you want to remove the tumor, so you can again perform mastectomy. Or the patient has abnormal uterine bleeding and the only way is to remove the uterus. So again, in that way, the removal of the uterus could be considered curative or therapeutic. Or yan, hysterectomy, 'di ba 'yon? Now, it could be ablative or through excision if it involves removing or cutting out of an organ or body part from the client. Yan, very good. Removal of diseased organs. Ang dami niyan. Kanina nabanggit ko na hysterectomy, cholecystectomy, 'di ba? Basta kapag nakarinig kayo ng ectomy, that means you are to remove the organ. Okay, very good. Ayan, alam na alam, no? Next, you have constructive. Alam nyo na yan, okay? Constructive, ito ay yung mga congenitally defective organ. Constructive surgery, yung ginagawa sa merong mga cleft lip and palate. Okay? Constructive ang tawag doon. Kasi kapag sinabing reconstructive, okay, it involves repair. Okay? Ibig sabihin, hindi siya, nung ipinanganak siya, okay siya. Constructive, yes, sa may mga born, congenital nga siya. So, if they were born with congenital defects, then kinorek mo yung problem, that's constructive. Okay? Let's say, there is imperforated anus. So, kapag maglalagay tayo ng perforation doon, that is constructive kasi ipinanganak siya na meron talagang problem, okay? So, you will construct, okay? Aayusin mo siya. Pero pag reconstructive, previously it's okay, but then na-damage siya. Okay, ganito yon. Nose lift, ma'am. Ayan, ang nose lift, ganito yan. Or rhinoplasty. It will be considered constructive if ipinanganak siya na wala siyang ilong. Okay, may ganun yon ha, constructive siya. Kaya lang rhinoplasty can be considered reconstructive if na-aksidente siya, tumama ang ilong, tumabingi ang ilong at inayos mo. Reconstructive siya. Okay? Pero kapag siya ay, okay, gusto ko lang ma'am tumangos kasi hindi ako nabiyayaan, okay? Medyo kinulang. So, ang gagawin nyo doon, ang tawag na doon ay cosmetic surgery. Okay? Talaga nagsabi pa kayo ha? Nagsabi pa kayo kung sino. Okay? 'Di ba? Bakit yung tatlong yon? Kasi it's just one condition, but then you can classify it according to the purpose. Okay? According to the purpose. Tandaan ha, iba ang constructive, reconstructive, at cosmetic surgery. Okay? Iba-iba yan. Okay? Depende ano bang reason. Ay ma'am, pinanganak na wala. Okay, constructive. Ay ma'am, nasira na aksidente. Aayusin natin, reconstructive. Ay ma'am, talagang ganun lang. Gusto lang niya ng, okay, maiba yung itsura niya. Cosmetic siya. Okay? So, tandaan nyo yun ha, hindi sila pare-pareho. There are differences. That's why they are classified based on their purpose. Okay, now apart from that, ayan, meron pa yan. Syempre, palliative naman, if it can't cure the condition, but it can relieve the distressing signs and symptoms. Let's say, for example, for a client with increased ICP, let's say traumatic brain injury. Okay, nagkaroon siya ng traumatic brain injury. Tumaas ang ICP. Okay? We will do burr holing, burr craniotomy, magbubutas dito, magdi-drill. Will it cure the problem? Will it cure traumatic brain injury? No. But it will relieve yung increased intracranial pressure, mapapababa niya. It will decrease the intracranial pressure. Therefore, you are relieving the distressing signs and symptoms. But then again, the patient must be treated separately for the traumatic brain injury. Okay, so ganun yung palliative. Okay, so again, hindi niya kayang i-correct yung problem, hindi niya kayang i-treat yung problem, but it will help the patient feel better. Sa bloodletting, ang tawag dyan is phlebotomy. Okay, yan. May nagtanong kasi. Ayan, phlebotomy ang tawag doon. Again, phlebotomy can also be palliative in cases of clients with cardiac problems. Okay, yung merong mga, yung may tetralogy of Fallot. Okay, so may mga cases na tumatanda sila, but then again, nagkakaroon ng increased RBC production. So in those cases, magbabawas kayo ngayon ng red blood cells. Okay, so phlebotomy ang tawag doon. Okay, phlebotomy. Okay, you do that not to correct the problem, but just only to relieve the distressing signs and symptoms. Of course, you know amputation. Okay, when you cut off a body part, that is amputation. Okay, so you amputate the limb, you amputate the hand, you amputate the foot. Okay, and we know usually the reason for amputation could be because of infection, di ba? If it's already gangrenous. So to save the other healthy limb, you remove the gangrenous part. Okay, so common among clients with diabetes mellitus. Replantation, ayan, totoo to, it can happen. Let's say for example, I think there is this incidents before, 'di ba, yung tumama yung braso niya sa LRT or sa train. Tapos ang ginawa nila properly tawag dito, kinuha yung natanggal na limb. Okay, tapos diniretso agad sa hospital. If the tissues are still healthy, you can replant. You can replant the limb. Okay, that's possible. Ididikit uli mga vessels, ididikit uli yung mga, ididikit uli yung nerves. Okay, so yun. Sa liver, okay, sa liver, if it is taken from someone else, hindi na replantation ang tawag doon. That is already transplantation kasi galing na sa iba. Pag sinabing replantation, galing sa mismong pasyente. Okay, may na-sever. Okay, pag sinabing sever, may natanggal, may naputol. Okay, and in most cases, okay, itong nare-replant na to are limbs. Limbs. Okay? So upper, lower limbs, or for boys, the penis. Okay, yung penis, pwede siyang ma-replant kapag pinutol. Okay? Yes. Ang gagawin lang, so you have to keep the the severed limb safe, okay, and viable by means of putting it on an ice bath. Okay, ilalagay siya sa ice. Pero dapat covered siya ng as much as possible if you can find sterile plastic, 'di ba? If not, the cleanest possible plastic, tapos ilalagay siya sa sa ice box, okay? Pero as much as possible dapat hindi directly nandun sa tawag dito sa ice. So usually you put it on one bag and then you put it on another bag na merong fluid sa paligid, tapos saka mo lang siya ilalagay sa ice. Kasi in some cases, magkakaroon naman ng burn, 'di ba? Kahit na malamig 'yan, meron din tayong tinatawag na parang mga ice burn, ganun yung pwedeng mangyari. Yan, oo, totoo yan. Yes, sa Grey's Anatomy pwede yan. Natawa naman ako dun sa interest ninyo sa erection. Okay? Pwede pa rin, 'di ba? Bakit naman ikakabit 'yun kung hindi na 'yun gagana? Okay? Bakit ba ikakabit 'yun, boys? Sa tingin niyo bakit niyo gugustuhin ikabit uli? Okay, props lang. 'Di ba? Hindi naman papayag na props lang 'yun, okay? So, 'yun. Yung mga individuals who are born without limbs, hindi tayo pwede, so far wala pang limb transplantation. But what they can do is to use prosthetics. Ayan na, may message na. Yes, you can use prosthetics. May mga robotic na prosthetics na ikinakabit sa mga limb, tapos may ability na sila na may pagka-AI na yung dating, na it can already detect nerve signals. So the brain itself can control the digits. Okay? May mga ganun ng prosthetics. Pero syempre depende sa budget ng client. Okay? So yun. Ayan. So again, no need for surgical kapag ganun, prosthetics na yun. So ibang department na ang may hawak nun. Okay? Ayan, natuwa kayo masyado sa replantation. Let's move on. Next, we have cosmetic surgery. So alam nyo na to, di ba? So kapag hindi kayo masaya sa itsura ninyo pagtingin sa salamin at marami kang perang pwedeng waldasin, so pupunta ka kay Doc at sasabihin mo, Doc, patulong. Okay? Then after that, thank you, Doc. So alam nyo na yun, cosmetic surgery. So kapag may maliit na gustong palakihin, may malaki na gustong paliitin, may flat na gustong patangusin, ayan, cosmetic surgery ang tawag doon. Kung initially ay hindi naman siya dadamit.
Excuse me, ma'am. Excuse me, ma'am. Ma'am, i-out ko po muna, ma'am, sila Arne. In pain po siya sa tiyan niya ngayon, ma'am. Sila Arne Arroyo, ma'am.
Sige, nasan ba siya?
Naiyak nga po siya. Grabe daw ang sakit ng tiyan niya, ma'am. I-out ko nga muna, ma'am. Salamat,
yes, ma'am. This is already recorded, ma'am. So, she can
thank you po.
Recording. Sige po. Sige po. Okay. Ayan, kinabahan naman ako sa kaklase ninyo. Okay, so again ha, tandaan nyo ang prioritization of needs. Okay, kapag yan ay physiologic, ayan, pag yan ay physiologic, unahin ang sarili. Okay, as much as possible, kaya naman tayo may recordings para kapag talagang hindi kaya, 'di ba? Ibibigay sa inyo yung recorded lecture, ha? Okay? Tandaan nyo, aanhin nyo pa ang matututunan ninyo kung hindi nyo naman magagamit, 'di ba? So, tandaan yon. So again, going back, cosmetic surgery. Sexual reassignment is actually considered as cosmetic surgery. Okay? If you will look at the it will be considered cosmetic surgery. Kaya lang nasa psych tayo, no? Kaya lang there are some sexual reassignment that are done because of gender dysphoria. So in that case, they are considering it as palliative. Okay, they are considering it as palliative. Depende, 'di ba? If you have gender dysphoria, medyo marirelieve ka ng konti kapag hindi mo na nakikita yung penis mo doon or kapag may iba kang nakikita doon, okay? So when we say sexual reassignment, ito yung ginagawa ng mga transgender So, yung may penis, then they want to feel female, patatanggal nila. Okay? Or they want to have something there, may prosthetics din na nilalagay. Hermaphrodite kasi is a condition na, 'di ba? Parang physically, genetically girl ka, pero meron kang iba doon. So, pwede rin namang patanggal yon, pero hindi siya considered as sexual reassignment kasi technically speaking, hindi mo naman i-reassign yung sex kasi talagang ganun ka. Okay? Kung babae ka, talagang babae ka. So, yun. Okay? So, yan. Cosmetic surgery. And then lastly, we have transplant surgery. So, transplant, it is replacement of an organ or body part by insertion of another from a different human. So, babalik tayo dun sa liver kanina. So, that's why, let's say may problem ka sa liver, tinanggal yung isang part ng liver, then kinabitan ng ibang liver, it will not be considered replantation. Kasi, yung idinagdag mo, yung replacement mo ay galing sa ibang tao. So, that's why it will be considered transplant surgery. Okay, so sa ngayon, almost, there are so many organs na that can be transplanted. 'Di ba? There are so many organs that can be transplanted. Ang ethical dilemma lang sa transplantation is the relationship between the donor and the recipient. Kasi isa sa mga problem with transplant surgery is the concept of organ buying. Okay, yes. Apart from compatibility, isa pang napapansin dito is organ buying. Okay, kaya nga as much as possible, we only get donors, living donors who are part of the family. Okay? Then kapag walang relationship, it can be thought na organ buying na pwedeng ma-defer yung transplantation. Okay? Yes, it's either kamag-anak, okay, living donor na relative or talagang close friends, no? Or deceased donor. Ang problem naman sa deceased, again, dapat meron kang consent bago ka mamatay na you are willing to donate your organ. 'Di ba? Meron tayong organ donation card. Kaya lang di naman masyadong nagagawa. So family, pwede silang mag-decide for the person. Pero, again, isa pang issue dito, may iba na mga nag-harvest, mga illegal na harvesting ng mga organs. So, again, that's now with ethics. Okay, ethics na yung merong doon. Is it true na pwede po? Yes, pwede yan na part lang ng organ. Let's say for example, liver. Part lang ng liver yung kukunin. Parang pipiraso lang sila sa liver mo na ibibigay doon sa isa. Pwede yon. Lungs. Ayan, pwede rin yan. Nakukuha lang and then ililipat doon. So, yan. Sa news, pig's heart, kasi sabi nila anatomically and genetically, medyo compatible ang human saka ang pig. Pero, it is still under debates pa. Okay? Kasi may iba na hindi pa rin talaga pwede. Yes, hindi kasi siya, kaya nga medyo yun, dinidebate pa talaga if it can be offered to everyone. Kasi the success rate immediately after the surgery, it's good. Kaya lang the prognosis is not as good as those who received actual human heart. Okay? So, yun. Yan. Okay? Diba? Exciting ang periop. Okay. Ay, kapag heart po ay nakukuha rin ba yung nararamdaman ng nag-donate? Mai-inlove din ba siya? Okay. Tandaan natin na ang emotions ay nasa brain. Okay? Wala sa heart. Okay. It's just ano ba yan? Anatomical pun, okay? Na pag in love ka talaga sa puso mo. Pero technically, if we will look into scientific basis, emotions are controlled by the brain. It's just that kapag nakikita mo yung crush mo, hindi mapakali yung puso mo, okay? Kasi nga, 'di ba? It will trigger your sympathetic nervous system. Okay? It will trigger your sympathetic nervous system kaya magkakaroon ka ng taki. Okay? Kaya well, as someone who is not well versed in medicine, ang iisipin mo ngayon, tumitibok-tibok yung puso mo kasi nakikita mo yung crush mo, okay? Pero ang totoo nun, yung brain mo yung nagsasabi sa heart mo, tatubig ko ka ng mabilis kasi nandyan yung crush mo. Okay? Oo. Kaya ngayon, kapag sinabihan kayo na ikaw ang tumatakbo sa puso ko, ay nako, hindi totoo yan. Okay? Wala ako sa puso mo, dapat nandun ako sa brain mo. Okay? Dapat nandun ka sa brainstem. Kasi nandun ang ating, nandun ang ating, tawag dito, heart center, okay? Pero syempre nasa hypothalamus at nasa natin ang emotions, okay? So, yan. Sige na nga. Oo. Yes, kaya from the bottom of your hypothalamus. Yes, not from the bottom of your heart. Anong makikita mo sa bottom ng heart niya? Okay? Left and right ventricle lang 'yon. The joke lang. Okay? Sige, we are being so na. Okay. Yan. So next, surgery can also be classified according to the degree of risk. Natatransplant mo. Yes, they have already experimenting on brain transplant. Okay? Pero not yet scientifically successful. Okay? Kasi usually, kapag transplant yung brain, kasi napakadaming dapat i-consider, lalo na kapag 'di ba? Kasi ang ending ng death ay brain death. Okay? So, they are still looking into yung na yon na. Pero alam ko meron na silang mga tinitingnan pero again, hindi pa siya ganun ka-viable. But the idea is there. Okay? Yan. So, according to the degree of risk, balik na tayo sa discussion. Now, surgeries can be considered major if it's extensive, if it's prolonged, if it include large amount of blood loss, if vital organs such as the colon, the heart, the lungs, the brain, the liver, okay, will be handled or removed, okay? Manually handled or removed. And there is a great risk of complication. Now, we know that, syempre, on the opposite side, you have minor surgery, which is generally, okay, it may take about 5, 15, 30 minutes, okay? It's not prolonged, very few complications, and less risk. Yes, ortho is considered major. Bakit major ang orthopedic procedures? I am referring to mga ORIF, open reduction internal fixation, because bones are considered as major organs. Okay, and syempre, if the procedure is not successful, it can lead to paralysis of the limb. Okay, and paralysis of any of our limbs can greatly affect our activities of daily living. Okay? But for procedures such as yung maglalagay ka lang ng pins, mga close reduction lang, it may be considered as minor surgery. Yes, ang sayang mag-scrub ng ORIF. Okay? Napakaraming instrument nyo na makikita na hindi nyo commonly makikita. Kasi ibang mundo ang orthopedic surgery. Okay? And then just imagine using drills, 'di ba, habang nagsa-surgery. By the way, kaya pala ako ang napunta sa perioperative nursing kasi sa lahat ng CA1, I have long experience of being inside the operating room. Okay, before ako nag-lecture, I stayed inside the OR for 6 years, 7 years. Huwag nyo nang tanungin kung anong taon, okay? Pero most of my clinical experience is in OR. Ang saya lang sa OR kasi tulog ang pasyente, walang relative sa loob. Okay? So, yun. Next. Ayan, minor surgery. Okay, so okay na tayo dyan, major and minor surgery. Yes, perioperative nursing is one of the most exciting for me. Okay, kasi you see things that not everyone can see. You can see the heart beating, the brain pulsating, you can see how your bones really look like, di ba? You get to use equipments that some may not be aware of. Okay? Now, surgery can also be considered or can be classified according to urgency. Of course, we know emergency. Pag sinabing emergency, it needs to be done ASAP. Ito hindi na tayo masyadong strict when it comes to fasting, 'di ba? Talagang kailangan gawin agad-agad. So, we do this, ayan, to save life. Ibig sabihin, nakikita niyo naman sa ano yan sa mga movies, 'di ba? Na barel o dadalhin agad sa OR, straight sa OR kasi you have to remove and you have to correct kung ano man yung nagbi-bleed sa loob. Or you need to save a limb na kapag hindi siya na-manage agad, pwedeng magiging option mo na is amputation. Or again, emergency CS, okay? You have to deliver the baby right here, right now, okay? Dalhin mo na agad sa OR yan or else mamamatay yung bata. For appendicitis, lalong-lalo na if it's ruptured because we know that ruptured appendicitis can immediately progress into sepsis. Okay? And sepsis is quite lethal. Okay? Next is imperative. Ibig sabihin, ma'am, bakit dyan yung CS imperative? Depende sa reason. Okay? Pwedeng magkaroon ng emergency CS kapag nakita namang dry na yung fluid, no? Wala na masyadong amniotic fluid. Or there is the fetus is in distress, 'di ba? Meron na talagang fetal distress. Pero kunyari ayan nagle-labor na yung nanay and then meron kang cephalopelvic disproportion or nakita mo na medyo tawag dito leaking na yung bag of water, so it can be considered as imperative. Or pwedeng tawag dito with the let's say there is cholecystitis, okay? The gallbladder is inflamed but not yet ruptured, okay? Pwedeng imperative 'yan. So it can wait 24 to 48 hours so you can prepare the patient well for the surgery. You can still carry out all of the preoperative checklist. Okay? Yeah. Next, planned or required. Ayan, ibig sabihin it's necessary for the well-being. Pero, it doesn't necessarily mean that it has to be done in 24 to 48 hours. Example, again, cataract. Okay, so it's necessary for the cataract to be removed or else the patient will go blind. Pero, it's not emergency. You don't need to do that right now. You can wait for a week, for 2 weeks, okay? You can forgo the surgery. Okay, pero it needs to be done. Okay? Elective naman, it can be done to correct a non-life-threatening condition. Now, this would be subject to the surgeons, the surgical facilities availability, or the request of the patient. Let's say, for example, elective ang herniorrhaphy. Okay, if you know hernia, okay, may lus-lus. Okay, pwedeng i-elective yan. Depende kung kailan ang gusto ng pasyenteng gawin, kung kailan available ang surgeon, kung kailan available yung surgical facility. Okay? CS can also be elective, 'di ba? If initially you have identified that the patient needs to undergo cesarean section, then it can be scheduled. Let's say for example, previous CS. Na CS na siya previously, so alam mo na CS siya uli ngayon. So you can schedule the cesarean section as long as term na yung baby. 'Di ba? Ayan. Vasectomy is considered as vasectomy is technically, according to urgency, it is elective, pero it is ambulatory. Okay? It is elective at the same time ambulatory. Elective because vasectomy is, di ba? Vasectomy is something that the patient will decide, that the couple will decide, then it can be done anytime they want. Okay? Hindi kailangan ngayon na agad. Okay? It's not required. Okay? We do not require patient to undergo vasectomy. Okay? It is their choice to undergo vasectomy. Then bakit siya considered ambulatory? Kasi ang vasectomy, sandali lang yan. It can be done in less than 30 minutes and then the patient can go home immediately after. Okay? Ito. Ini-skip ko lang yung optional kasi tamang-tama yung tanong on vasectomy kasi nga it is elective at the same time ambulatory. Now, when we see optional, okay, you do that for aesthetic purposes. Actually, if we will consider vasectomy can also be considered optional but not for the purpose of aesthetic for aesthetic means pero optional in a way na it's for family planning. Okay, pag sinabing optional, okay lang kahit na hindi mo pagawa. Okay? Walang reason para ipagawa mo siya. Talagang ginusto mo lang siyang gawin. Again, meron ka namang ilong, okay? Nakakahinga ka naman ng maayos, pero gusto mo lang siyang gumanda. Okay? Optional 'yon. Okay? Meron ka namang dibdib, okay? Na meron naman siyang mammary glands, pero aesthetically speaking, gusto mo pa ng mas malaki. Okay? So optional 'yon. Okay? Again, optional. Ginusto mo. Now, breast reduction, pwede rin naman 'yan. Pero usually, breast reduction can be considered elective. Bakit? Kasi the reason usually for breast reduction is back problem. Masyadong mabigat to, babawasan kasi nagkakaroon naman sila ng spinal problem. So if that's the case, you can consider elective. So as you can see with urgency, it can be classified as two or more classifications. Removal of moles, ayan. Removal of moles could be optional. It could be optional if it's really because, ma'am, ayoko magmukhang Nora Honor. Patatanggal ko siya. Okay, however, there are some moles that shows characteristic of it being malignant. Kaya bago pa siya mag-develop ng malignancy, patatanggal mo na siya agad. Okay, so elective yun mako-consider. Okay, so depende again, bakit mo siya patatanggal? Ayaw mo lang ba ng itsura niya? Or dahil baka kasi cancerous to? Okay, so you can consider that according to urgency. Ang moles ay hindi naman nakaka-cancer. Ang problema lang, meron lang iba that shows signs of malignancy. 'Di ba? If it's you know naman the ABCs of skin cancer, 'di ba? Alam niyo yung ABCs ng skin cancer. So, consider niyo 'yon. Ano ba yung size niya? Lumalaki ba siya? Because normally ang mole dapat hindi siya lumalaki. Is it elevated? Do you have jagged edges? Okay, so all of those things you have to consider. Okay, so again, on ko na 'yon. Okay? Uy, bakit magpapadagdag ka? Okay. Wala namang side effect yung nagpapadagdag. Alam niyo na siguro yung gustong padagdagan niya, okay? Pero mabigat lang siya. Okay, yun lang naman yung sinasabi nila, mabigat lang siya. Okay, kasi syempre, magdadagdag ka dyan. So imagine mo, yung dinagdag mo, lagi mong daladala. Okay? So, yun lang. Pero kung dahil naman sa dinagdag na yun ay mapapasaya ka, feeling mo okay na okay ka, then it's their option. Kaya nga optional yun. Okay? Yan. My goodness, parang matatapos tayo 8:00. Okay? Next, we have the various types of surgical procedures. Ayan, ito na yung mga familiar na kayo dito. Okay, for a while lang. Okay. Wait lang ah. Narinig nyo yun, ano? Okay. Next, we have the various types of surgical procedure. So according to incision, ayan, so when we say incision, this is cutting of the tissue to form an opening. Now, it can be considered otomy if you are considering to cut into, magbubukas ka lang, and then you will really view it. So otomy. Ostomy naman, you will create a temporary or permanent opening. Okay? Kaya nga, ayan, laparotomy. Phlebotomy, mag-i-insert ka. Gusto niyo pati yung PowerPoint ko? Sige, isa-send ko na. Pero yung PowerPoint ko, as in wala tong ka-effort ha. So, sobrang ano to, mabilis. Kasi hindi naman ako talaga, ngayon lang ako nag-CA. Ngayon lang uli ako nag-CA. Okay, kaya pagpasensyahan nyo na yung PowerPoint ko. Okay, so again, pero I will share it to you. Sige. Okay, remind nyo lang ako. Alam nyo naman, lagi ko nakakalimutan. Okay, so pag sinabing otomy, you will be cutting into. Katulad ng phlebotomy, mag-i-inject ka ng needle, maglalabas ng blood. Okay? Phlebotomy, opening lang siya. Then, anuhin mo na. It's only for viewing or for you to bleed off. Ganun lang. Pero pag sinabing ostomy, you will be providing an opening. It could be temporary, it could be permanent. Kaya nandyan yung colostomy, jejunostomy, okay? Ileostomy, 'di ba? So may mga temporary or permanent opening na binibigay. Ostomy. Centesis naman, it's only for, well, to puncture, to perforate, for the purpose of extraction. 'Di ba? So paracentesis, katulad niyan. You will be removing the abdominal fluid. Thoracentesis, okay, or thoracentesis. So you will be removing the fluid inside the cavity, okay, sa may pleural space ng lungs, no? So yun, that's centesis. So these are the three types of incisions. Now, procedures or surgical procedures can also be considered an excision, okay, form of excision. So when we say excision, you cut out a part. So dito papasok yung ectomy. You will be excising, removing. You get, pabigyan siya nung ano, please. Okay? So yan, tonsillectomy, vasectomy, 'di ba? Kasi sa vasectomy, hindi mo naman tatanggalin yung buong vas deferens, okay? Pero magtatanggal ka ng part ng vas deferens. Okay? Magtatanggal ka ng part ng vas deferens. So 'yon. Ectomy, 'di ba? Appendectomy, cholecystectomy, okay? So you remove or you cut out, you excise. Could be a tumor, it could be an organ. Exeresis naman is to strip out. So example yung ginagawa sa varicose vein stripping. Okay. Nakalimutan ko yung term. Okay, so okay. Dali, hindi ako mapapakali. Okay. Okay. Yeah. Varicose. And yon yung ano yan. Exeresis is the actual term itself, okay? Varicose exeresis. Ayan, varicose exeresis yung term. So, pag sinabing varicose exeresis, naisip ko talaga yung mismong procedure, no? Varicose exeresis, yun yung mag-aano ka nga, ayan, magtatanggal ka, you will strip off yung part, okay? So, yun. igaganon mo. Ano ba? Yon, yung milk out. Milking, 'di ba? Parang ganon, yung mini-milk mo yung parang sa tube. Ayan, pwede rin natin gawin yan sa vessels, pwede yan sa nerves, okay? So, exeresis. Tawag. Okay? Sclerotherapy yon kapag ini-injectionan. Okay? Sclerotherapy. Okay? So, yun. May mga ini-inject. Pwede rin naman yon. Sclerotherapy. Okay? Kaya yung iba, pinagsasama sila. Okay? Pero again ha, tandaan nyo yung mga procedures na yan sa varicose veins, very, very risky. Okay? Very risky. Kasi yung mga nandyan sa varicose veins na yan, remember, those are thrombos. So, pwedeng magkaroon ka ng pulmonary embolism. Okay? Ayan, vein ligation. Yun. Yes. Sa vein ligation, after stripping out, magtatanggal ka ng portion ng vein. Okay? So, yun. Yan. Okay? Next. Saan na tayo? Amputation. And so, we know amputation, you cut off a part, and we are usually referring to an appendage. So, ayan. So, we are pertaining to the limb. Or syempre, sa lalaki, may iba silang appendage doon. Pero generally, it's the limb. So, pag sinabing disarticulation, you remove it from the joint itself via, they can hear your video. Okay, pag sinabing disarticulation sa mismong joint. Okay, kunyari, disarticulation of the leg. Ano ba ang joint that connects the leg to the other part of the body? So it's the it's the knee. So ang disarticulation of the leg ay ina-amputate sa knee joint. Let's say itong finger, disarticulation, sa finger pala, we usually use the term dismembering kapag buong tatanggalin. Pero let's say ito lang yung i-disarticulate mo, itong pinakadulo lang na to. Okay, disarticulation ang tawag doon, sa pinaka-joint lang. Pero kapag tinanggal ko yung buong daliri, dismember yan. Bakit dismember? Kasi grupo sila. Okay, grupo kasi yan. Fingers and toes. So kapag may isa kang tinanggal na daliri, sa paa, dismembering ang tawag doon. Tinanggal mo siya sa grupo niya, 'di ba? Member, okay? Tandaan niyo 'yon. Parang feeling niyo joke pero hindi joke 'yun, totoo 'yon, okay? Next, of course, amputation. Pag ginamit na yung word na amputation, ibig sabihin hindi siya kinut through the joint, pero kinut siya sa pagitan or doon sa mismong buto. So it could be amputation through the tibia or the fibula. Okay, so amputation 'yon. Or femur, di ba yan? Amputation. Yes. Okay? Yeah. Totoo yan. Di na siya member, kaya dismember na yon. Okay? Next, you have endoscopic procedures. So, this is the inspection of a cavity or the viscera, okay, by means of an endoscope. Now, we usually have the suffix oscopy. Ayan, so this is cystoscopy. Okay, cystoscopy kasi ang i-visualize ay ang urinary bladder. Okay? Or yan, endoscopy naman. It could be lower kapag sa anus papasok. It could be upper endoscopy kapag naman dun papasok sa upper GI. Ayan. Okay? Next, repair. Siyempre, dito nga, you have reconstruction, reforming, fixation, or stabilization of a part. Now, these are the suffixes that you may encounter. So, plasty is the formation of a body part. So, you have rhinoplasty, diba? You shape it. Okay? You shape it. Again, depende sa purpose. Ostomy naman, when you provide an opening, kung mapapansin nyo, ma'am, nabanggit na rin yan kanina. Yes. Okay, pwede naman din yon. Okay, this is anastomosis. You repair it in a way na magdadagdag ka. So you join two vessels together. Anastomosis yun. Desis, we do this for tendon repair. So when you bind a body part, so tenodesis, and so it's with the tendons. And then you have fixation or suspension of a body part. So scapulopexy. Scapulopexy. So ito kapag nagkaroon ng na-disarticulate, nawala sa pagkakaano yung scapula. So we perform scapulopexy. Okay? Next is to destroy, so destruction. So when you break down tissues, of course you have yan, refracturing. Sometimes we do that. We promote fracturing, okay? It's osteoclasis. Okay. Lithotripsy naman, that's for stones. If you are, litho means stones. Okay, then tripsy means to destroy. Lithotripsy is a procedure that wherein radio waves, shock waves rather, shock waves are directed into the kidneys to destroy the stones. Okay, the kidney stones. So it can pass through the ureter and eventually exit the body. Okay? Yan, neurolysis naman if the nerves are tawag dito na ipit. Ayan. So when you need to free something, you use the word lysis. So neurolysis, freeing of the nerve. Yan. So those are the suffixes that, well, kasi sa surgery, as long as you know the suffix and you know the prefix, you would have an idea of what the procedure is all about. Okay? Yan. Siyempre, we can also do suturing. Okay, so this is what we do when we need to stitch. Okay, using a suture material, yung mga itong mga ng clients natin. Okay? Yan. I'll see later, alam ko nandito yung discussion ko tungkol sa sutures. Alam ko meron ako nun. Kapag wala, ibabanggitin ko. Okay. Kasi parang alam ko tinanggal ko na dito yung iba kong mga ang tagal na nung huling gamit ko nito eh. Kaya pagpasensyahan nyo na hindi ko na masyadong na-edit. Okay? Yan. Phases of surgery. So we know 3 phases. So we have pre-op phase, you have your intra-op phase, and you have your post-operative phase. Okay, yes. Pre, intra, and post. Let's talk about the pre-operative phase of a surgery. Ang mahalaga sa pre-op ay, syempre, this is what happens during the procedure. So, yan, meron tayong checklist. So, very good yan. Ang pinakamahalaga is consent. The patient can be prepared and all, but if there is no consent, you should never perform the surgery. It is considered illegal. It is actually considered as battery and assault kapag inoperahan mo yung pasyente without their consent. Kasi nga, this is an invasive procedure. Siyempre, don't forget to remove dentures, jewelry, and contact lenses as it can interfere with the actual procedure. And you would be using mga instruments, you'd be using electricity, diba? So, all of those things for safety as well. Okay? Then, contact lenses are also removed. Kasi you don't know how long the surgery will last. The patient should be on NPO for at least 6 to 8 hours. This is to prevent aspiration pneumonia. This is also to, ayan, tandaan naman natin, di ba, tawag dito, lalo na if you are performing bowel procedures, 6 to 8 hours is not enough. Usually kapag bowel procedures, we put them on liquid diet 24 hours before the procedure, and then NPO for at least 10 to 12 hours kasi the bowel must be clean. So isa rin yan sa mga dapat i-consider. Now, you gather the complete health history. Who secures the informed consent? Ang nagsisecure ng informed consent ay ward nurse. Tapos pagpasok sa OR, i-check ni OR nurse kung merong consent yung client. Kasi si OR nurse, nasa loob lang siya ng OR. Hindi siya lalabas ng OR just to get the consent of the client. So it's the responsibility of the ward nurse. Kapag naka-brace, hindi naman yun. Depende sa procedure kung kailangan tanggalin yung braces. Oo. Si circulating nurse yung mag-check ng consent ng client pagpasok sa OR. Yan. Okay, mamaya i-discuss natin yung tungkol sa consent. Okay, may separate discussion ako tungkol sa consent after this. Okay? Ayan. Pina-check po ako nun. Okay? Yan, sige. Okay, we conduct pre-op health teaching. Mamaya i-discuss din natin yan. Okay? Lahat yan meron nga pala yung separate discussion. Nakalimutan ko. Then we give pre-op medications. Okay? First, consent. Ayan, sabi nga natin, alam naman natin yan, na-discuss nyo na yan. The purpose of consent is, first and foremost, it will relieve the patient of anxiety kasi consent being informed, alam niya kung ano yung procedure na gagawin sa kanya. So, it's a hard proof that the patient is aware of what is to be done. Another is that when the patient signed the consent, that means we did not pressure them on having the procedure done, that they authorize for the procedure to be done. So if there are problems during the course of the surgery, okay, the procedure will be considered legal. So whatever claim the client has, ayoko nito, hindi ako pumayag dito, but if they sign the consent, syempre, ang i-follow pa rin natin, it's not the statement of the client, but the document that they have signed. Okay? Yes, very good. Kasama sa consent, dapat sinasabi natin ng maigi yung totoo tungkol sa procedure. Okay, yung totoo tungkol sa procedure. Hindi yung, di ba, you will not just give them the positive sides, the positive effects of the procedure, but you have to tell them exactly, okay, what are the pros and cons, what are the advantages and disadvantages. You can also give them options. Okay, pero tandaan, ang nagdi-discuss nito ay surgeon. Ang nag-e-explain. Surgeon ang nag-e-explain, si nurse ay nandun lang, nakikinig. Pag may tanong ang patient at wala na ang surgeon, si nurse na yung sasagot. Okay? So yun. Hindi tayo magbibida-bida dito na ikaw ang magsasabi. Ay, ito yung gagawin sa'yo ni Doc. Ito ang mangyayari niyan. Okay? Wag ganon. So, dapat surgeon. Okay? Ayan. Paano pag sinabing wag sabihin sa client na yung negative side? Ethically, that's incorrect. The patient has the right to know what will happen to them. Most especially if they have sound mind. But if the patient, ayan, nakalagay dyan, di ba? If the patient is a minor, okay, then the primary decision is on the parents. Okay, so pwedeng yung patient, nakikinig lang siya, pero not necessarily. Pwedeng ang buong data ay sa parents sasabihin. If the patient is mentally ill, if the patient is unconscious, ito, pwedeng hindi na sabihin sa pasyente. Kasi ang consent niyan, doon naman gagaling sa relative. Okay. Yan. If you want to ask something, yes, raising hand pala, Samo, why are you raising your hand? Have any questions? Sorry, I muted you. Do you have questions, Rohaida?
Ma'am, wala po, ma'am. Napitit lang po.
Okay, sige, sige. Yes, if they are not married, still considered na nearest kin ay family, parents. Okay? Parents ang nearest kin. So, yun. Ma'am, kahit live-in partners sila, ayan, yan na yung meron na ngayong debate. Paano kapag live-in partner, if they are considered as common law wife or common law husband and wife. If they are living together and they are tawag dito, they don't have legal papers kasi. Still ang pinagde-decide pa rin is relative. Legally speaking kasi we are talking of legalities. We are talking of legalities. Okay? Wait lang. Okay. May sudden change of plan. Yes, it can happen. During the surgery, nakita, wait lang. Hindi pwede ang repair. It happened to one of our procedures before. This is exploratory laparotomy. It's just initially to repair the perforated bowel. But when they looked at it, hindi kaya ng repair lang ng perforated bowel. Kailangang maglagay ng, tawag dito, i-remove yung part ng bowel. Okay? So if there are changes with the plan, if they signed consent for a certain procedure and you need to do another procedure, the surgeon needs to step out, inform the relative at that point, get the consent, and return to the client. Saka pa lang pwedeng gawin yung procedure na gagawin nila. Okay? So yun. Gandaan yun ha. Yun ang isa sa mga ethics talaga na dapat nating i-consider. Call ng surgeon yun. Close friend. Actually, hindi pwede kahit close friend. Kapag walang relative during those time, ang usually ang ginagawa, they need to call the relative. They need to call the nearest kin. Authorizing whoever is with the client to make decisions for the patient. Okay? Kung ayaw ng patient magpa-opera, kahit na kailangan yung surgery, instead of getting the consent, you get a waiver that the surgeon and the hospital has no liability whatsoever dun sa mangyayari sa kanya by not deciding to take the procedure or have the surgery done. Okay? Tawag dito. And alam niya yung risk, that the risk of not having the surgery is discussed well with the client. Waiver ang kukunin ninyo. Kasi kapag namatay ang pasyente, then sasabihin, bakit hindi nyo inoperahan? Ruptured pa lang appendix niyan. Ayaw nga magpa-opera ng client. Pakita nyo yung waiver. Walang pananagutan ang ospital kasi ipinaliwanag sa kanya ng maigi how needed the procedure is. Okay, pero ayaw lang niya. Waiver ang kailangan nun. Medical proxy, yes. There are cases na merong mga medical proxy. Pwede yun. Okay? Actually, we are talking about theoretical. Diba? Theoretical yung pinag-uusapan natin. Kasi kapag sumagot kayo sa board exam at sumagot kayo sa exam, the basis of the exam is your theoretical knowledge. Okay? Ma'am, kasi paano kapag talagang mag-isa lang sa buhay kapag ganyan? Kasi theoretically speaking, the court must assign a legal guardian. If not, it is the call of the surgeon, not of someone else, to push through with the procedure or not. Okay? Kasi yun. It's the call of the surgeon. So kung pumayag naman yung kaibigan niya it will all go back to the surgeon. Gagawin ba niya yon kahit yung kaibigan lang yung nag-decide? Okay? So yun, na hindi yung, ay, umokay ang, ang kaibigan, o gawin na natin, umokay na yung kaibigan. Hindi pa rin pwede yun. Dapat mag-decide pa rin sa surgeon, gagawin ba niya yon kahit na kaibigan ang nag-decide. Okay? Kasi ganun ang consent. It's the nearest kin, or the legal guardian, or the court-assigned, tawag dito, guardian of the client. If there's none of the above, the surgeon will have to decide whether or not to proceed for the procedure or not. Okay? Ayan, humahaba na yung storya natin. Kapag ba sa exam ninyo tatanungin, what if the surgeon is the friend of the patient? So again, babalik ako doon sa sinasabi ko. The surgeon must decide. It is the surgeon's call to proceed with the surgery or not. He will decide as a surgeon or will he decide as the friend? Nasa sa kanya yon kasi siya pa rin ang may call kung gagawin o hindi yung procedure. Okay? So yun. Siyempre, actually ang decision maker kasi sa field, ang decision maker sa OR, ang captain of the ship is the surgeon. Okay? The captain of the ship is the surgeon. The nurses and the anesthesiologist can voice out their concerns. But at the end of the day, it is the surgeon's call. Tandaan yon ha, it is the surgeon's call. Kung sinabi mo, ikaw yung nurse, surgeon, doc, I'm sorry, pero I don't like to do the procedure. Then you have to put that in writing. If you think your comment is relevant, if you think that there is illegal, that the procedure is something that should not be done, and then you voice out your concern, but still the surgeon decided to do that, put that in writing. Okay? But your decision, hindi yan majority wins. Hindi yan democratic. Okay? Pagdating dyan, may pagka, may pagka, not totally, dictatorship, no? Pero may pagka-autocratic pagdating sa doktor, pagdating sa surgeon. Again, uulitin ko ha, kapag wala sa iba, surgeon ang magde-decide. Alam nyo ba, over-analyzing makes you more anxious. Sinasabi ko lang, kasi imagine ang dinidiscuss pa lang natin, consent. Pero napakarami nyo ng, ma'am, what if, what if, what if, what if? You know what? Asking those questions are good. But then it will make you confused pag tumingin na kayo sa questions. Kasi the questions are not, the questions are not so complex. The question talks about the basics, talks about the theoretical knowledge. So all of these webs of questions can actually confuse you. The more question you ask me, and the more answers I gave you, the more confused you will be. I tell you. Okay? I tell you. So kaya, the purpose of this review is for us to really focus on what is necessary. Okay? Necessary. Kaya nga ang sinasabi ko lang paulit-ulit, kahit na gaano, kasi I don't know guys, hindi nyo makikita, napakarami kasing questions dito, napakaraming scenario. Pero wag na kayong magtanong, kasi bakit? Babalik lang ako dun sa sasabihin ko. That the consent must be taken from the patient. Kapag wala ang patient, from the nearest relative or kin. Kapag wala ang relative or kin, court-assigned guardian. Kapag walang court-assigned guardian, ang ending ay surgeon. Okay? Wala nang iba pa. Okay? Wala nang iba pa. Kasi kapag ang dami nyo pang kinonsider, at alam nyo, overanalyzing ang tawag dyan. Hindi naman yun ang nakasulat sa question, pero at the back of your mind, what if itong question na to, ganito kasi yung scenario? Ay, overanalyzing na yan. Alam nyo, malilito kayo nun. Malilito kayo sa exam. Kasi lahat ng question sa exam, lahat yan parang tama. Lahat yan, in a way, merong correct point. Kaya, paano nyo makukuha yung pinakatamang sagot? You go back again to what is most relevant. Okay? Alam nyo kung bakit ko to sinasabi? Kasi nakita ko yung scores ng exam ninyo. And I am really frustrated. Okay? Hindi siya ganun kataas. Okay? Ang passing natin ay 60. I can count on my hand kung ilan lang ang naka 60 pataas. Okay? Then I am thinking, bakit kaya? Well, again, ngayon I think I know the reason. Okay? You may be over-analyzing. Okay? You can be over-analyzing. Okay? Alam mo, that's the reason why your first guess may always be the correct guess. Kasi yung initial guess ninyo, yung initial hunch ninyo, you are not yet affected by other thoughts. Okay? Pag inulit-ulit nyo na at you already read between the lines, those are not existing. Those concepts are not existing. But you read between the lines, alam nyo, malilito kayo nun. So kayo, ay, dali lang. Parang tama to kasi kung ano, ayan, malilito na kayo doon. Okay? So again, okay. Well, I don't mind having all of those questions around. Okay lang yan, okay lang yan. Kasi you are thinking. That's critical thinking. Kaya lang iba yung critical thinking sa overthinking, okay? So if it's not stated there, then it's not stated there, okay? Tandaan yun ha. Ay nako, kayo talaga. Sinasabi ko. May nag-raise yata ng hand doon sa ano. Meron ba sa Gmeet? Okay. Wag na kayong magtanong. Bakit? Okay, bakit? No, I encourage thinking okay lang naman 'yon. Okay lang magtanong. Okay lang magtanong. Pero minsan, katulad kanina, yung sinabi ko na, at the end of the day, surgeon's call. Then ang dami pang sinasabi. Ang dami pang mga side comments. Okay? Ang dami pa. So kaya I thought na that could be the reason. Okay? Wag ganon. Consent pa lang yan. Okay? Consent pa lang yung dami niya nang iniisip. Okay? Pero tandaan yun, ha? Now, sabi kanina, ma'am, kailangan ba isa lang? So, isa lang ang magde-decide. Pero, merong mga witness. At doon papasok ang nurse, doon papasok yung ibang mga authorized person. Okay? Witness tayo na proof na ang pasyente ay sinabihan, na ang pasyente ay pinagpaliwanagan, tungkol dun sa procedure. Okay? So, yun. Tandaan yan, ha? Ma'am, retake daw po ng prelim. Sorry, hindi pwede mag-retake ng prelim, ha? Okay? Galingan nyo sa exam nyo on Friday. Okay? Galingan nyo sa exam ninyo on Friday. Dapat siguro may test-taking strategies tayo, no? I'll see kung maisisingit namin sa schedule ang test taking para at least you are guided. Okay? So yan, nasaan na tayo? Okay? Ay, nawala na ako. Okay na. Ayan. Pag nagtatanong, ma'am, ano yung married emancipated minor? Pag married emancipated minor, anong final sched ng CA? Ang CA1 ay CA1 pala kayo, no? Saturday pala kayo, sorry. CA2 ang Friday. Sorry, CA2 ang Friday. CA1 kayo Saturday. Saturday 4 to November 19? No. Bakit naging November 19? It's on November 12. Ang exam? Talaga ba? Sorry ha, hindi kasi ako. Okay. Sige. Ano ba yan? Minadali-madali ko pa tong peri-op natin na to. Tapos, sa 19 pa pala kayo. Nakita niyo naman yung biyahe ko kanina, di ba? Umalis ako ng school ng past 1. Kasi nag-ayos kami ng test paper. Para makarating ako dito ng alas 3. Hindi namin alam. Okay, hindi namin alam. Up until earlier, magkakausap kami ng ibang magkakausap kami nila Ma'am Perez, nila Doktora. Ang alam namin ay Saturday. Talagang dali lang ah. Okay, hindi talaga alam. Okay. So again, we'll talk about consent. So sabi nga natin, pag consent, again, this is necessary. This is important. It's for the patient and also for the hospital. Oo, yes. Umuwi ako agad. Okay? Hina kasi ng internet sa office. Ngayon, sobra. Okay? If the patient can't write, so the same, lagyan lang ng X, and then usually pwede na yung thumb mark. Tapos may mga witness. Okay? May mga witness. Kapag emergency, ibig sabihin yung in a matter of an hour, kapag kunyari 1 hour tapos, excuse lang, via, malakas na naman yan. Okay? Let's say for example, in 1 hour, tapos hindi siya magawa, pwedeng ikamatay ng client natin. Well, definitely, ang gagawin natin dyan, ay, ano tayo tawag dito? Telephone na yung dapat gawin, tatawag sa nearest relative, and then you can have the procedure done. Okay, but again, the consent must be taken within 24 hours. Okay, so ang CA2 daw ay as is. Okay, next. Yeah. So there are various types of consent. This is just for the purpose of information. Kasi kapag operating room, pag surgery, hindi lang isang consent ang hihingin ninyo. Okay, meron tayong tinatawag na general consent. Ito yung consent na pinipirmahan ng client during admission. That they consent to all the routine care, yung mga typical na procedures na ginagawa, yung magbibigay ng gamot, maglalagay ng IV, those are what we call as routine care. In short, the patient don't need to sign every now and then consent for medication, consent for diagnostic purposes, consent for blood extraction. Hindi na kailangan ng pasyente yon. Kasi all of those procedures are part of routine hospitalization. So covered na yun ng general consent. Now, for a certain procedure, katulad nito, surgery, ayan, kailangan ng informed consent. And usually, ang consent natin sa OR, we have two. You need to have an informed consent for the anesthesia. So the anesthesiologist will discuss to the client what drugs will be given, what's the purpose of anesthesia, okay, what type of anesthesia will be given. Dapat yan alam ng client. Then there will be a separate consent for the actual procedure itself, which will then be discussed by the surgeon. Okay? Dapat yan hiwalay na dinidiscuss. Okay? Kasi iba ang risk ng anesthesia, iba ang risk ng surgery. Okay? Ang risk ng anesthesia is not part of the surgery itself. Kasi iba ang ginagawa, lalo na if you will be doing general anesthesia or spinal anesthesia. 'Di ba? Meron siyang ibang risk involved. Okay? So the same goes with surgery. So remember that informed consent must be taken by the ward nurse, but then again, making sure that the doctor and the anesthesiologist have really discussed the condition or discussed the procedure to the patient very well. If Hindi na-disclose ang information. Sinabi ng pasyente, hindi ko alam. Bakit nyo ako inooperahan? Hindi ko alam. Okay? Kung ano yung mga mangyayari. That is an act of negligence. Kasi it is the role of the surgeon, it is the role of the anesthesiologist to discuss the procedure and to discuss the anesthesia itself, okay, to the client. Okay? Tandaan, it must be documented properly. And again, this is usually when it is the responsibility of the ward nurse to have this signed, pero another responsibility for the OR nurses, specifically for the circulating nurse, to make sure that the patient has signed the consent prior to entering the OR. Kailangan bago pumasok ng OR, may pirma na. Kapag pumasok ng OR, nakita ni circulating nurse, walang consent, the procedure can be deferred. Anong ibig sabihin ng deferred? It can be canceled. Okay? It can be canceled. Kailangan mo nang makuha yung consent. Pero pag emergency, yes, it will be considered not valid kasi talagang walang procedure. Negligent yun. Negligent act yun. Okay? So, bawal yun. Call na ng surgeon yun. Kapag nagreklamo ang pasyente, pwede niyang i-sue ng assault and battery yung ospital and medical negligence. Okay, tandaan yun. Nangyari yan sa RMBGH. Bakit gano'n na nangyari? Usually, ang ginagawa sa consent form, in most cases dalawa yung pipirmahan nila. Dalawa, yung isa consent for anesthesia, yung isa consent for surgery, pero isang document lang. Pero dalawa. Kaya kapag ooperahan ang client, the patient must be visited by the surgeon and the anesthesiologist themselves. So yung anesthesiologist, hindi yan iniisip nyo na doon na lang niya nakita yung pasyente sa OR. No. Dapat bago operahan yung pasyente, dadalawin niya yung patient to discuss the anesthesia. Kasi part yun ng consent. Okay? So yun. Dalawa yun. Okay, it's part of the pre-op checklist. Okay, so again, ito. If the surgeon intends or wants to perform this procedure that is not on the consent form, sabi nga natin, wala sa consent form, si circulating nurse ang mag-i-inform sa surgeon. Surgeon, hindi po yan ang pinirmahan ng client. Kung gusto niya talagang gawin, dapat i-explain niya uli yun dun sa relatives. Kasi syempre, sedated na yung patient at that point. So, hindi na pipirma yung patient. So, pupunta siya dun sa relative and then para pirmahan ng relative yung ano tawag dito, yung consent. Ayan. Common yan sa mga exploratory laparotomy cases. Diba? Let's say, una, akala nyo it's just a simple ovarian mass. Yung pala hindi lang ovarian mass, may iba pang problem. So, balik dun sa client. Or, let's say, ang ano niya ay tayuso lang dapat. Total abdominal hysterectomy, unilateral salpingo o oophorectomy. Dapat isa-save pa yung isang ovaries. Kasi, based sa ultrasound, based sa diagnostic imaging, okay yung ovaries. Okay yung isa. So, isa lang ang tatanggalin. Pero nung binuksan, hindi pala. Dapat pala tatanggalin na ng buo. So, again, balik, labas, inform. Okay? Or nag-CS ka. After ng CS, there is severe bleeding. Then there is uterine atony. Kahit na anong gawin, hindi talaga nagko-contract yung uterus. Then the patient is bleeding profusely. That your only option is to remove the uterus. Dapat yon, labas uli, sabihan ang asawa, sabihan ng relative, or minsan, lalo na kapag spinal anesthesia naman, minsan ginigising yung client. Okay? Kapag spinal. Pero kapag general, hindi pwede yun. Okay? Kasi kailangan consent must be taken. Or, i-close kung kayang mag-intay ng 24 to 48 hours bago i-reopen yung pasyente. Okay, may mga ganong cases. Kaya ma'am, kaka-opera lang niya, bakit operahan uli ngayon? Okay, maybe they need to get the consent. They need to discuss it further with the client. Okay, so yun. Next, ayan, syempre, part of pre-op care is teaching. Tandaan nyo, bakit mahalaga ang pre-op teaching? First and foremost, if you teach the patient after the procedure, the patient is in pain. The patient can't remember what you are saying. Okay? The patient can be hysterical if it's too painful, di ba? So, that's why pre-op teaching is important because you will teach them on what they need to do after the procedure. Okay? Yes, you have to consider the level of consciousness as well. Okay? So, kaya itong mga to, i-discuss natin siya kahit sa ngayon hindi pa kailangan ng pasyente. Because they need to plan ahead para after ng procedure, they know what to do. Okay. Number 1 that must be included is turning. So, you inform the patient that it is important to turn from sides to sides after the procedure. Okay, once it is permitted. Okay? Meron kasi ibang mga client na right after the procedure, they have the tendency to just lay down and say, oh, di ba? Yung ramdam nilang sila ay inoperahan. Okay? Ayaw gumalaw, ayaw kumilos. But then again, remember that turning is very important because it promotes circulation, it also promotes peristalsis, and also it prevents pressure sores. Okay? And even for respiration. Di ba? Napakaraking factor ng turning. Also, kasama dyan would definitely deep breathing. Diba? They need to learn how to do deep breathing because it prevents hypostatic pneumonia. Yun nga yung nakahiga lang siya tapos wala masyadong ginagawa. Then ang babaw pa ng hinga niya, then tendency for pneumonia is very high. So that's why we encourage deep breathing to prevent hypostatic pneumonia and also to prevent atelectasis or lung collapse. Okay? And syempre, added bonus na yung better oxygenation. Next, the use of incentive spirometry. This is to gauge or to assess the breathing ability and efforts of the client. Okay? Yan. Meron tayo yan sa school, di ba? Coughing is also important. Okay? It promotes the removal of chest circulation at the same time, it also promotes lung expansion. Okay, but then again, kasama sa coughing at deep breathing, ano ang proper positioning? Lalo na if the procedure is, if it's an abdominal procedure or dito sa thoracic procedure. So, definitely the use of pillow, di ba, while coughing or deep breathing would be essential. Okay, para hindi ganoon ka-painful kasi minsan kaya hindi sila huminga ng malalim kasi mamansakit ng tahe or pag umupo sila ay mamansakit ng tahe. And the chances of dehiscence and evisceration is very much likely kasi pwedeng biglang mag-rupture yung mga stitch. Okay? Didiscuss natin yan, dehiscence and evisceration. Pagdating sa post-op kasi those are complications. Okay? Next is foot and leg exercises. Again, this is to prevent thrombophlebitis. Okay? You are promoting circulation. Okay? Encouraging proper venous return. And of course, it may also help in preventing abdominal distension. Yan. And lastly is splinting the incision. So yun nga yung sasabi natin, gagamit sila ng pillow or abdominal binders. Okay? To prevent pressure upon the site, it lessens the bleeding, it also controls pain, at the same time, it decreases the risk for evisceration and dehiscence. Ayan ang mga dapat i-discuss, okay? Before the procedure, because this will help the patient to have better recovery and faster recovery after the surgery. Next, syempre, di ba, meron tayong consent, teaching. Next is fasting. Ayan. Generally, ito yung ginagawa, okay, in most cases, okay? in certain cases. Kapag kunyari, naka-clear liquid lang yung client, pwedeng mag-fast lang siya in 2 hours. Minsan ganito yung ginagawa for CS. Di ba? Emergency CS. Emergency CS. So, sasabihin kailan yung last meal mo. Okay? Kapag medyo ano pa, ano lang naman, yung last ko lang naman ay ano lang, uminom lang ako ng tubig kasi ano na po ako, uhaw na ako. Alam nyo, kahit na 2 hours lang yun, pwede na. Okay? For breast milk, about 4 hours. For non-human milk, 6 hours. Light meal, 6 hours. Heavy meals, ito 8 hours. Bakit? Ano ang purpose nila? Because this is the rate of digestion for these type of meals. Okay. Clear liquids can be digested and tawag dito, and move to the lower abdominal or to the lower GI tract in as early as 2 hours. Breast milk, mabilis ang digestion yan. So, kaya 4 hours. For non-human milk, mas matagal kasi ang digestion ng non-human milk. Okay? So, kaya yan, 6 hours. Light meals are also 6 hours. Pero for regular or heavy meal, it's safe for 8 hours. Pero again, the preoperative fasting may still vary depending on what procedure to do. Earlier, I mentioned, di ba? Kapag kunyari, it will involve bowel resection. Ano yung bowel resection? Ito yung bowel, yung colon, magtatanggal ka ng isang malaking part. Kapag ang procedure would require bowel resection, being on NPO for 8 hours is not enough. Usually, you put the patient on a clear liquid diet 24 to 48 hours before the procedure. What's the purpose of clear liquid diet? Okay, the purpose is para ma-cleanse yung bowel. So when you open it, the presence of fecal material is very less likely. Diba? Kaya nga, bukod sa clear liquids and then NPO, minsan ine-enema pa natin sila. Okay, just for us to make sure na yung buong ano na yon ay clean. Almost clean, okay? Hindi man siya sterile talaga, pero almost clean. So the chances of having fecal contents splashing on the abdominal cavity is very less likely. Okay? Kapag bowel, okay? Kaya iba ang preparation kapag bowel procedures. Okay, isa yon sa dapat i-consider. Pero for general procedures na ang purpose ng fasting is just to prevent aspiration, to prevent so ang gagawin nun ay again, we follow yung 8 hours. Katulad ng mga cesarean section, ayan, yung ORIF, okay, so para lang maiwasan na may isuka sila, so we do this, we utilize this table. Okay? So yan. Next, medication. Okay, pre-op meds. Ayan. So before the procedure, okay, usually we prepare the patient, and one of the preparation is to give the patient certain medications. It could be, ayan, sabi nga natin, di ba? It could be given, okay, for the purpose of ensuring that the peak effect is at the time that the patient is already inside the OR. Kasi just imagine, if you will put the patient inside the OR, then ang peak effect ng gamot na yon is 90 minutes. Ibig sabihin, you have to wait bago mo gawin yung procedure. Okay, so kaya ito ay ginagawa na sa ward para pagdating sa OR, ready na ang client. Okay, the patient is already at the peak of the effect of certain medications. So, as part of the pre-op meds, usually ang mga binibigay dito is mga sedatives. Okay? Kadalasan na binibigay niyan, sedatives. And then yung iba naman, nagbibigay na rin ng mga antimuscarinics. Ayan, atropine is an anticholinergic, 'di ba? So pwede na ring magbigay, binibigay na 'yan. Usually dapat anesthesiologist ang nagre-request, ang nag-order, tapos ibibigay na para pagdating niya sa OR, ready na yung patient, ready na for induction. Okay? During the discussion of intraoperative nursing, we will talk about the different phases of anesthesia. Okay, para yung ano ninyo, familiar kayo, ano ba yung nangyayari when the patient is anesthetized. Okay, yan. Next, sabi niyo siguro, hindi nag-prepare si ma'am ng presentation pero meron pang animation. Kasi this is the presentation I had years before. I just updated on some parts. Pero mostly, peri-op is peri-op pa rin naman. Okay? So, pre-op meds natin. So, you have the sedatives and tranquilizers. If you can see, the purpose of pre-op meds, it's to allay fear and anxiety. It's to produce amnesia. Yaan yung mga reason bakit magbibigay tayo ng sedative hypnotics. Yang reduce reflex irritability at yang reduce the pain threshold. Yun. Okay? Kaya magbibigay ka ng sedative hypnotics. You are familiar with this. You are familiar with benzodiazepines and with barbiturates. Okay? Now, benzodiazepines are usually these are usually given as the drug of choice, okay? Mas madalas ginagamit ang mga benzodiazepines as compared to barbiturates, okay? Barbiturates is really used kapag very anxious talaga yung client. It is given, barbiturates are given the night before the surgery, okay? So yun. Then antiemetics are also part of this. If the patient, usually nagbibigay ng antiemetics and antinauseants kapag emergency procedure. Yun talagang hindi tayo nakapag 8 hours na fasting. Yung medyo 2 to 4 hours lang yung naging fasting kasi talagang emergency siya. Magbibigay tayo antiemetics. Okay? Even nga kahit 1 hour lang, okay, talagang emergency CS yan, kailangan talaga. Call ng anesthesiologist kung papayag siya at magbibigay na lang siya ng antiemetics. Okay? Then benzodiazepine naman, it's important kasi talagang yung purpose niyan for amnesia, for sedation, okay, it's very much effective. Kaya ang kadalasang kasama sa pre-op preparations talaga is giving diazepam, lorazepam, or midazolam. Okay? Pero ang madalas na binibigay, ayan, is lorazepam and midazolam. Mas madalas siya. Okay? Ayan. Sa mga anesthesiologists makikita nyo minsan midazolam, naka slow IV infusion, minsan nga naka-ano pa yan, naka-drip. May midazolam drip yung client. Okay? So diazepam is given orally for pre-medication. Lorazepam can be given orally or IM. It also has antiemetic action. And then the action is faster than diazepam. Okay. Midazolam naman is usually given, okay, as part of conscious sedation. Pag sinabing conscious sedation, alam niyo yung sedated sila pero nakakausap mo pa rin. Okay? Kadalasan yan, nasa twilight zone kapag nakamidazolam. Nagsasalita, nagkukwento, pero totoo inoperahan na siya, di ba? Medyo lutang na lutang pa yung client. Okay? Yun yung conscious sedation. Okay? Then, ayan, nabanggit na natin yung barbiturates and antiemetics. Yan. Yes, pwedeng gawin yan sa brain surgery. Yung gising yung client, not totally gising na gising, pero may brain activity. Kasi they are looking into brain waves. 'Di ba kapag brain surgery, nakaano rin yan sa brain waves. Kasi kapag ikaw ang nagbigay ng diazepam talaga, at tulog na tulog ang pasyente, ang brain activity niyan mababa. So kapag kailangan i-check yung brain activity in certain portion of the brain during the procedure, ayan, pwedeng gawin yung midazolam. Or, yan, conscious sedation. Or minsan, safe din kasi ang midazolam. Sa mga CS, yan din yung binibigay. Yung napanood. Yeah, totoo yan. Feeling ko Korean novela yan. Okay? Parang napanood ko rin yan. Okay? So yan, pwede yun. If they are testing the brain function while the procedure is ongoing. Okay? Yan. Next, tatlo kasi yan. Tatlo yan, sedative hypnotics, narcotics, and anticholinergics. Yan ang binibigay natin. Yan ang triad ng mga gamot, okay, pagdating sa operation. So narcotics, we know the purpose of narcotics is to provide analgesia. Okay, it's to provide analgesia. Okay, so for the patient not to feel pain. Okay, it will help raise the pain threshold. Okay, and with this, less anesthetic will be given. Okay, less anesthetic will be given. So, nandiyan ang morphine, meperidine, fentanyl. Okay? Mas madalas ibigay ay demerol at fentanyl. Okay, morphine not usually given because of its prolonged duration. Pero may mga anesthesiologists na gustong-gustong gagamit ng morphine. Isa rin kasing tawag dito, napakadami mong i-monitor. You really have to closely monitor the client's vital signs if you are using morphine. So mas yung effect ng morphine as compared to meperidine and fentanyl. And then lastly, for pre-op, you have your antimuscarinics or anticholinergic. Okay? Antimuscarinics, anticholinergics, ang purpose nito is to inhibit mucus secretions. Okay? Kaya nga, dyan papasok si atropine sulfate. Okay? Madalas gamitin si atropine sulfate. Okay? As an anticholinergic. Kasi nga, syempre, di ba, if you decrease mucus secretion, so the chances of aspiration pneumonia is very less likely. Okay? Kasi hindi naman talaga may iwasan na maglalabas ka ng mucus ng dire-diretso. Also, ayan, it may produce bronchodilating effect, okay, and parasympathetic depressant. So, yan, anticholinergic. Madalas ibigay atropine sulfate. Okay? Ma'am, wala namang anesthesia dyan. Wala ngang anesthesia kasi ang anesthesia ay binibigay during, okay, the stay of the patient inside the OR. So, ang anesthetics hindi binibigay as pre-op meds. As preparation, ano uli yung tatlong gamot na ibinibigay? We give sedative hypnotics. We give narcotics. Sedative hypnotics, the purpose is to allay anxiety. Okay, then you have your narcotics to increase the pain threshold, and you have your anticholinergics to prevent mucus secretion. Sila yung ibibigay bago operahan ng patient. And then, kapag nasa loob na ng OR ang client, so we are now going to intraoperative nursing. Ayan. I-discuss ko lang yung facility ng maikling-maikli, and then all other concepts we will discuss on Saturday. Okay? Para lang makabawas-bawas din. So tandaan na sa operating room, pagpasok ng pasyente, intra-op na yon. So we must be mindful of what we are doing, on where we are, and what we are wearing based on these areas. When we say, yes, I will upload the recording on YouTube, and then I will send the link to the class president so it can be disseminated. I will also be including that on your Canvas. Okay? So yun. So you have the unrestricted area. This is the outermost first opening ng OR door. Pagpasok mo sa OR door, that's still unrestricted. Diba? You can still use your street clothes, you're still using your shoes. Okay? Street shoes. Pero from that unrestricted area, meron na dong maliit na kwarto. Okay? Na magbibihis ka na, magpapalit ka na, kasi pagpasok mo, you need to have your body and head coverings. And you have to have another or a different set of shoes. Okay? So, semi-restricted area is limited only to properly attired personnel. Again, those who are already wearing scrub suits, your scrub shoes, your cap, and your masks. Restricted area. By the way, semi-restricted, ito yung common area ng mga OR personnel. Okay, common area ng mga OR personnel. Pag sinabing restricted area, ito yung mismong operating room. Yung mismong OR. That's your restricted area. Okay? So this is where you need to wear your masks, your cap. This is where the sterile procedures are being carried out. This is the actual operating room. Okay? And then, syempre, there are various individuals on this area. And that will be discussed on Saturday. Okay? So, I will be ending our discussion for now. So, it has been, 2.5 hours. So, we will have another discussion, another set of discussion on Saturday. Okay? So, do you have any questions at this point?